All right, good evening, everyone. My name is Dr. Robert Brown. I'm in Bloomington, Illinois, and I am the owner of Elite Chiropractic and Rehab. And alongside me tonight is my special guest and friend, Amanda Burton, who is a licensed massage therapist here in Bloomington as well. And Amanda, thank you so much for joining us tonight.
Thank you for having me.
Absolutely. So tonight, our broadcast is called Ease Your Mind. And we're going to talk about learning how to control stress so that it doesn't control you. And bear with me, I'm having a technical difficulty here. Okay. Okay, I apologize for that. So trying to get my PowerPoint to work and I'm having a little bit of difficulty here. Here we go. Okay, so there we are. We are tonight's speakers. I'm Dr. Robert Brown and there is Amanda. And the first slide here, we want to talk about stress. How bad is it really? Well, in 2014, there was a study done by the American Psychological Association. They found that 77% of people regularly experience physical symptoms caused by stress. Now, I don't know about you, Amanda. I'm going to say that number is probably closer to 80 or 90, if not higher in my office.
I would definitely say so. Yeah, the main reason people come in for massage is stress.
I would think that if stress did not exist in our society, you and I would not have jobs.
Probably not. Yeah, probably not.
We'd be doing something else.
There would be no need for us. So.
That's true. In fact, you may even know someone who has died too early because of stress, and I hope that's not the case. But we want to convey the message tonight that stress is very overwhelming and it's very detrimental to your health. And guess we're going the wrong way. So our goals tonight, we have 3 goals. Goal number 1 is we want you to understand just how bad stress really is. Our second goal is we want to give you some techniques that you can use at home for dealing with stress. And then number 3, we want to provide you with some professional options for handling stress. I'm going to go out on a limb and guess that chiropractic and massage therapy are on that list.
I think so. Yep.
Just a guess. So anyway, according to Google, just how bad is stress? Google says, when you do a Google search, it says chronic stress may include disease, either because of changes in your body or the overeating, smoking, and other bad habits people use to cope with stress. And other forms of chronic stress, such as depression and low levels of social support, have also been implicated in increased cardiovascular risk. And how bad is it for your health? Well, they can affect your body, your thoughts, your feelings, and even your behavior. And being able to recognize common stress symptoms can give you a jump on managing them. Stress that is left unchecked can contribute to many, and I do mean many, health problems, namely high blood pressure, heart disease, obesity, and diabetes. So here's a question for you. Pop quiz. Is stress bad or good for you? The answer
is bad.
Bad, very, very bad. And some stress-related conditions. I know Amanda and I, we see a lot of this in our offices, but headaches, people present with headaches all the time. Fatigue, negative eating behaviors, anger, that's a big one. Anxiety, depression, stomach problems such as feeling nauseated, and flu-like symptoms. So again, stress is extremely debilitating when it starts to overwhelm your system. And what do the stress hormones do to the body? And this is where it all starts. It starts in your adrenal glands, which are these glands located on top of your kidneys. And they release a surge of hormones, namely adrenaline and cortisol. Adrenaline increases your heart rate, elevates your blood pressure, and it boosts your energy supplies. Now, there's going to be a lot more on this later. In fact, I had my part of this presentation done. It was all about sympathetic, parasympathetic, and Amanda said, guess what? That's what I'm doing too. So you're going to get a heavy dose of this tonight. This is going to make a lot of sense by the end of this broadcast.
Yes.
And dealing with stress. So we accomplished our first goal. I'm just telling you, stress is really bad. And hopefully we've conveyed just how bad it really can be. So now we want to get into the next section is, what are some things that you can do at home to help improve your levels of stress. And so we're going to start off with a super secret tip number one. And I jokingly say it's secret because these first few are going to be, extremely obvious. But the first is going to be diet. So the big thing with that is you want to avoid excessive amounts of caffeine. So if you're walking around with a big thermos of coffee every day, or you drink, 6 liters of soda every day, and, doing all your caffeinated teas and eating lots of chocolate, that's a lot of the problem. I mean, gosh, especially, McDonald's nearby. Every size soft drink is $1, and they have a line from here to the other side of the city during the summer when it's, $1 soft drink. People drink a lot of soda, and they have a number of other harmful effects besides just the caffeine. But for tonight's topic, we're just going to talk about the caffeine. You got to lower your caffeine intake if you want to reduce your stress levels physiologically in your body. Also, if you drink alcohol, you want to do so in moderation because it is a toxin that induces symptoms of anxiety, and it damages your liver. And then a final thought here is when you have your mealtime dinner, you want it to be as calm and relaxed as it can possibly be. And tip number 2, rest. And I know that's a huge surprise. I mean, this just doesn't get any more obvious, does it?
Very shocking, yes.
So a good night of rest will help you reduce your stress. I know you would have never guessed that in a million years. But what I found interesting is I found a chart provided by the National Sleep Foundation. And if you look here on the screen, newborns sleep it's recommended that they sleep 14 to 17 hours a day, which I'm highly jealous of that, by the way.
Too. Yep.
We're over in this category, not the older adults, but I'm going to say we're more in the adults.
Adults.
Yeah, we're definitely not older. Yeah, so 7 to 9 hours of sleep is what is recommended. I feel the best with 8, 7 or 8, that's kind of where I'm at. But the important thing is that getting a good night of rest will help you reduce your stress.
And I think along with what Dr. Brown is saying, shutting off your electronics a little while before you're going to go to bed. A lot of people lay in bed, myself included, sometimes with my cell phone, but that just keeps stimulating your brain.
Right.
And it sort of prevents you from being able to wind down. So that's a way to kind of bring yourself down to a level of relaxation so you can get to sleep easier and get more of that sleep.
Right. Yeah, I'm guilty of that too. It's so easy to want to check Facebook one more time or check your email one last time. Yeah, just put all the electronics away and just try to let your mind relax as much as you possibly can. Now, the third thing, again, this is, I feel like you just call me Captain Obvious tonight.
Yep, that's right.
So exercise, okay? Obviously, exercise is huge. It increases your well-being, it reduces stress, and it releases your brain's feel-good neurotransmitters, which are called endorphins. And obviously, we're just talking about stress. We're not even talking about the other benefits of it, improving your cardiovascular health, improving like your muscle mass, and reducing your risk for osteoporosis. It eliminates cravings for unhealthy food. I mean, it just does so much. But in terms of stress, exercise is huge.
Yeah, and I think it improves your energy level during the day, and then it helps you sleep better at night. I found if I'm regularly exercising, I actually sleep better at night. So that kind of goes in with the whole sleep thing too.
Yep, right there with you. Now, the fourth tip, I kind of included this as a group, but relaxation, meditation, breathing exercises. They give you better focus, less anxiety, more creativity, more compassion, better memory, and less stress. And Amanda and I were talking about meditation, and she's going to know a lot more on that topic than me, but I started researching that, and I did not realize just the tremendous amount of depth and information that existed with meditation. I had a 7-minute video on meditation I thought about throwing up here tonight. And as I started diving into meditation, I realized there is just so much to it. And Amanda has some really good tips for how to meditate, if that's something that would interest you, because I know it'd be very helpful.
Yeah, and I found even just utilizing YouTube, you can just search on YouTube meditations, guided meditations, put your earbuds in and close your eyes, and some of them are 2 minutes long and some are 20 minutes long, but if you're afraid that you might not be able to meditate, that's a good way to start, is just to look on YouTube and see what you can find, and then to go to a meditation class after that or do it by yourself. But start small. I think people are intimidated by the thought of having to sit still and meditate for 20 minutes. So start with 1 or 2 minutes and then go from there.
Yeah. You know, the thought of sitting still for a long time, I think, man, how could I do that?
Yeah.
But 2 minutes, you know, we might be able to pull that off.
That's right. Yeah. Start small and build from there. So
that's right.
Yeah.
Okay. The next thing, so we've talked about some things you can do at home. Now we're going to enter the final part of the series here. We're going to talk about professional options. So we're going to begin with massage therapy, and Amanda's going to talk to you about that for a few minutes. And then I'm going to conclude with a discussion on chiropractic. So Amanda, I'm going to turn this over to you.
Okay, thank you.
You're welcome.
All right, go to the next slide here. Okay, so Dr. Brown talked a little bit about stress and what it does to your body. And some of the, there's a list here that you can see, but some of the really big ones are that if you're feeling stressed out, your heart rate is going to be increased. And I think we've all felt that before. When we're anxious or upset, our heart rate starts to go up, which causes our blood pressure to go up, which triggers anxiety. It's almost like a snowball effect of all of these things happening at the same time. It can cause tension headaches, and then you have trouble sleeping. And the worst thing about stress, I think, is that it lowers your immune system, so it makes you more susceptible to coming down with whatever is going around at the time that your kids bring home. It can change your appetite. It can cause you to be an emotional eater and overeat, or maybe not eat if you're really nervous. So that's really hard on your digestive system. And the list here shows even more. You can't focus as well, so it might affect your ability to perform at work or for kids at school. It's toxic. Stress is toxic on the body. And it increases your cravings for fat and sugar here, as it said, like with the emotional eating. So, and then that's bad for you, all that sugar. So it's almost like it just builds upon itself.
Right.
Yeah. So massage is one way that we can help with the stress response. There are different types of massage. So generally when we think of massage, we think of a Swedish or relaxation massage, which would kind of be more geared towards what we're talking about. As opposed to a sports massage, which is more invigorating. And there are so many different modalities and types of body work, but for this discussion, more just sort of a relaxation or Swedish massage is what we would be referring to. And massage studies have actually shown that a massage therapy session will lower your stress hormones in your body physiologically, which those are epinephrine and norepinephrine. And it regulates cortisol, which is known as the stress hormone. And for a lot of women, especially when they reach middle age, it's known that the increased levels of cortisol actually increases belly fat. So stress can cause you to gain weight and hold on to it around the middle. So that alone is a reason for a lot of people to want to lower their stress. Massage also increases dopamine and serotonin, which are known as the happy hormones. So similar to exercising, releasing certain hormones to make you feel better. This does the same, but with dopamine and serotonin. And sort of as a result of all of these, it can lower your blood pressure. And then as a result, it can improve your immunity, because in a massage, we're actually increasing the flow of blood and lymph in your body, and that helps flush out toxins that are floating around in your body, which you've probably been told after you have a massage to drink a lot of water. And that goes along with the whole reducing caffeine, but just replace that with some water. And that also helps your massage to have more of a beneficial effect on your body. So those are just some of the basic general effects of massage and how they can help you with stress. We can go on to the next one. It does, in general, all of that list that we just showed helps just to tell you that the body will shift from sympathetic to parasympathetic nervous system, which is going from your fight or flight, stressed out state of being to a more relaxed state of being, which is what we all try to achieve, but we have trouble. So sometimes we need help with something like a massage or like breathing and the other things that Dr. Brown told you could do for yourself. Massage does help a lot with tension headaches. I see a lot of clients who they have regular tension headaches, and the tension I find is in the upper shoulders and then at the base of the skull. And in many cases, a massage therapy session or several massage therapy sessions really help with the headaches. They help it to go away right away, but it also helps sort of prevent them from coming back, or people might find they get them less frequently. So And something I incorporate and a lot of massage therapists incorporate is the use of therapeutic grade essential oils. There have actually been studies shown that essential oils do increase blood flow to the muscles. So that's even adds to the effect of a massage. They can help regulate your blood pressure, increase oxygen flow in the blood. That's a pretty big one. Remove and reduce toxins, because those essential oils, what they do for a plant is protect it and remove the toxins from the plant. So it kind of does the same thing in our body. And all of this helps reduce cortisol. It can help reduce insomnia. So these things are all one of many effects that essential oils have, and the smell alone is relaxing for a lot of people.
It really is.
Sometimes we all have those scents or smells that trigger certain emotional responses, and essential oils, those can trigger relaxation, and it really, the aromatherapy really is a big part of a massage in sort of aiding in the whole reduction of stress. And I use them topically, and I use them in a diffuser in the room, so there are different ways. So for anyone who's watching this, if you would like to come see me for a massage sometime, I would offer you $20 off your first 60-minute massage with me, which is a $70 value to begin with. And that would be a great way to try massage therapy if you haven't tried it for stress reduction. So thank you very much for letting me share all of that information.
You're welcome. Thank you, Amanda. And that brings us to the next section, which is going to be the chiropractic section. And I'm going to be hosting that. And I just want to point out too, Amanda here, I've known her for a while, and she's one of the best massage therapists around. I mean, just humble, very kind, professional, takes great pride in her work, and I've had her work on me, and she's been great, you know.
Thank you very much.
You're welcome, and it's just an honor to have you here today.
Thank you so much. It's an honor to be here.
Great. So we're going to talk about chiropractic now for the final few minutes. And for those of you who are wondering, how does chiropractic work? I'm going to try to simplify this. And I'm going to point my mouse here. So if this is your brain, this is your body. The brain controls every single thing in the body through a bunch of nerves known as the nervous system. Okay? So when the brain and the body are functioning properly, basically your body is functioning at 100%. You know, as long as your nervous system is free of interference, your body functions at 100%. And forgot to tell you, so basically what happens is there are disturbances to the nervous system that occur, and those disturbances are known as subluxations. Subluxation is simply when bones are out of place. And I'm going to turn off my share screen and show you something here. Okay, I'm not seeing myself here, but anyway, I trust that you can see what I'm doing here. So basically, if these are the bones in your spine, known as the vertebrae, if these bones are lined up properly, these nerves are working properly that come off of the spinal cord. However, when these bones are out of place, we call that a subluxation. The problem is when you have subluxation, these nerves get irritated, and they can produce symptoms of pain, tingling, or numbness, and it can also cause loss of function to the organs in question. So subluxations are bad, and the only way to correct them is with a chiropractic adjustment, and that helps restore the function to the nerves. Now I'm going to share my screen again, so bear with me. Okay, I think I pulled this off. So subluxations create interference to the nervous system, and fortunately, chiropractors are the only skilled professionals in the world that detect and correct subluxations. And so it follows that chiropractic adjustments remove interference to the nervous system. So that is our way of making the nervous system work properly. And it follows that you should never leave a subluxation. So when you receive a chiropractic adjustment, it should feel like someone took a light switch and turned your power on. You should feel better. Your pain should be gone or reduced. You should feel like you have more energy. You have more adrenaline, and you have more of the feel-good hormones floating around in your body. You should feel more alert, more focused. You should just feel good. There's a big difference between being subluxation-free and being full of subluxations. And anyone that's been under good chiropractic care for a long time can attest to that.
I always feel great after I come get an adjustment.
Thank you.
Seriously, especially the neck area, because that's where I hold my tension, and I look forward to it, and I feel great when I'm done. I kind of have a spring in my step.
Right. So. Yep. I get adjusted every week, and I tell you, I just can't even imagine not being adjusted all the time. Yeah. It's wonderful. Mm-hmm. And I think I'm going the wrong way here. Okay, so to go back to our brain-body diagram, so if your brain controls the body through your nervous system, if you have subluxations, that causes dysfunction, causes your body to have dis-ease, so you're no longer in a state of ease, and it causes ill health. And do you think you'll feel good or bad? The answer is you will feel bad. So we go so far as to, we remove your subluxation so that we can make you feel better, give you your health back, put your body in a state of ease, and get your body as close to 100% function as possible. And here's a slide. This is going to look very familiar, but I like to use an example of, let's say you're laying on a beach, sipping a nice cold drink, whether it's water, Kool-Aid, whatever, and you're just in a state of ease and you're totally relaxed, life is good, when all of a sudden some gigantic scary bear comes jumping out of the bushes and scares you, you're going to have a fight or flight response. That's a sympathetic response. Your heart rate will increase. It will increase your blood pressure. It creates anxiety. We become overreactive. And all these things listed here, basically, that fight or flight response is good for the short term so you can run away from this gigantic bear. However, people live this way chronically for years and years and years. And we see that their quality of life is very poor. I mean, it causes changes in cognition, causes changes in appetite, raises their LDL levels. Big things that Amanda talked about, it reduces your immune system. So when people get sick, when they develop a flu, usually what happens is they are stressed out first, their nervous system is under stress, it lowers their immune system, and then they get sick. Mm-hmm. I kind of think along the thoughts that when you're adjusted properly and your nervous system is functioning properly, we can see hundreds and hundreds of patients every month, and we don't get sick. Right. Hardly ever, because when you're in alignment, your nervous system is operating well, you just don't get sick as often. I don't care if I have 20 patients that come in a row that are all sick, most likely I'm not going to catch it because my immune system is functioning optimally when my spine is in alignment, when my nervous system's working right. And so one thing that I find interesting is when you are sympathetically charged, it inhibits your ability to concentrate and results in you being easily distracted. And again, that plays a role with a lot of children with ADHD. And so you can see that there are just a number of very bad things that happen when your body is stressed out. And one thing we do in our office to evaluate just how stressed out you are is we do a test that measures heart rate variability. And this is a strong indicator of how well your nervous system is doing. I'm just going to touch briefly on what you need to know for it. So basically, an ideally adjusted patient should be in this green oval right here. And this black line down the center separates the left side from the right side. The left side is sympathetic, meaning you're stressed out. The right side is parasympathetic. So it follows that the further out you are from this green oval, the more stressed out you are. This person is distressed. We've seen patients within a month go from being out here to being in this green oval. This is like just an amazing indicator of how stressed out your body is. So we get a lot of patients that come in, they say, yeah, my neck hurts. Okay, but and I tell them we understand that. However, you're really stressed out. Do you want to just get out of pain, or do you want improved health? The choice is yours. And almost everyone says, yeah, I'm stressed out. I want to improve my situation. So that is one of the greatest things we've ever implemented in this office is being able to measure the heart rate variability, because it really tells us how healthy you are. And then also in addition to that, there are two other tests that go along with it. The autonomic nerves, basically those go to all the organs in the body, and the motor nerves, they control all the muscles in the body. So we measure the autonomic nerves with the rolling thermal scan. We measure the motor nerves with the surface EMG. We put them all together and we get something called a core score. That's something we've implemented in the last 6 months in our office. And it is a measure of your complete nervous system health. So it's cool. It has the heart rate variability, the surface EMG, and the autonomic nerve. So I mean, it's great. So we base a lot of our treatments on that because we're not just about getting you out of pain. Pain is just the tip of the iceberg. So we want you to have, better health. So when you come in, pain relief or improved health, the choice is yours because pain is just the tip of the iceberg. And finally, my last slide here, I wanted to finish with a new patient offer of my own. So basically, when you come in on your first day, we do a consultation history where we sit down and ask you all about your health, neck pain, back pain, digestive issues, cardiovascular. We ask you about all that stuff. We do a complete nervous system scan that measures your core score that we just talked about. We do a complete neurologic, orthopedic, and chiropractic examination, and we take a full set of digital x-rays. And then when you come back on your second day, we do a report of findings consultation where we tell you everything that we found, and we do all that for only $125. That's the cost of the digital x-rays. So that is a new patient offer. If you call our office and mention that you saw this webinar, we will honor that, and we would be happy to get you in as a new patient, hopefully within the next week or two. So anyway, I want to thank you very much for your time, and I'm going to undo my screen again. And anyway, I want to thank you all for your time. It has been a pleasure speaking to you, and if you guys have any questions or there's anything we can do for you, please don't hesitate to give us a call. And you guys all have a great evening, all right?
Thank you.
Yeah. Have a good night.